afternoon, everybody. Thanks for joining us today. We have such a great group of people. I'm really, really excited to introduce you and get started with the story. We've got some folks from Banner Health and SALESFORCE to share some really great insights on their strategy to really pioneer and modernize the healthcare experience and how healthcare is delivered today, and their latest launch as part of that endeavor. So what I'm going to do is I'm just going to introduce everyone and we'll dive into the details. Joining us today are Danielle Perry. Danielle is an 18-year sales and operations leader in the Medicare industry, currently overseeing Medicare operations at Banner Health. Danielle has specialized in helping to build health plans and call centers from the ground up. And as Banner Health is growing its insurance division, Danielle will be serving as the business leader for SALESFORCE implementations across the organization. Welcome, Danielle.
Thanks, JC.
And up next, we have Belinda Russell with Banner Health. Belinda has built a 20-year career around business operations, change management, business strategy, and customer success. She's spent about the last 5.5 years with Banner Health helping to align innovative product development to Banner Health's enterprise strategy, which we'll be talking about today. She's currently senior IT product owner, overseeing the design and deployment of all digital innovations for the company. Thank you for being here, Belinda.
Thank you, Jay.
Absolutely. From SALESFORCE, we have Amit Khanna. After earning an MBA at the NYU Stern School of Business, Amit built a 20-plus year career as a leader in enterprise software, CRM, and product strategy. Currently, Amit serves as Senior Vice President and General Manager for SALESFORCE's Health and Life Sciences Division. Welcome, Amit.
Thank you, JC.
Yeah. And last but not least, from Mastech, we have Venkat Alapalli. He's a 30-year information technology executive with about 20 years alone just in the healthcare industry, focused on implementing large-scale technology products in the public health space. Currently, he serves as Vice President for Health and Life Sciences practice here at Mastech. Welcome, Venkat.
Thanks, Jesse. Glad to be here.
Yeah. And now that we know who we're speaking to, let's just dive right into it. I think a great place to start would be to learn a little bit about Banner Health and just the scope of its practice. Danielle, can I ask you to just give us an idea of what Banner Health does?
Yes, of course. I'm going to share my screen for a minute here. And see. Okay, can everyone see my screen? Yeah. So we're going to jump in just for a minute here to talk about kind of what Banner Health is and what we're trying to do. This slide just kind of really represents our portfolio of services. It shows that we have both kind of we do have an insurance division as well as the delivery side of the house. Our services range from the pharmacy service side, the labs, we have a telehealth unit, our post-acute and acute divisions, as well as our ambulatory side of the house. That's all delivery. And then as you can see in our insurance division bucket here, we've got, the Colorado, the Banner Health Network, or U of A health plans, which is our Medicaid and D-SNP plans. We do have a commercial division, which is a dual partnership between Banner and Aetna. And then we have our Medicare Advantage plans. This slide represents that we are located in 6 different states. Right now, our Medicare Advantage plan and our Medicaid plans are specific to Arizona. We do have some bigger long-term visions to grow into other states, but right now, Arizona is our focus on our insurance and delivery side. And then just to walk through kind of what our motto is, right? Care and coverage is kind of what we put together. How do we make that member journey, that member experience from, they're insured, they walk into a hospital, they need a lab, they need an x-ray, they go back to their PCP. What is that integration between what that member journey needs to look like? How can we make the member experience better by understanding we do have the delivery side and we do have the insurance side? And looking at having the complete portfolio here with our Medicare Advantage plan for the senior market, our commercial plans for our commercial market, the Medicaid plans, and just integrating, systematically integrating what that care and coverage looks like for that member journey. And JC, I will kick it back to you.
Thank you. That's actually a great introduction. And now that we have an idea of that mission, that care and coverage, and some of the overarching strategy behind that, Belinda, can you take us through that initial decision, when it was made to design and launch that series of portals and dashboards that would transform the patient and, basically the user experience? Can you tell us a little bit about that?
Yeah, absolutely. And Danielle did an excellent job outlining the care and coverage, right? And I'm in a unique position where I've been on both sides now, the healthcare delivery side and the insurance division side. And this really began in the healthcare delivery space with our implementation of the Genesis product. Obviously, first and foremost, we needed to be able to centralize a lot of the workflow that we were doing. And so the initial implementation was about 2,500 agents, 300 locations, so that we could bring in a tool like Salesforce Health Cloud to really drive our scheduling experience forward. And so from our first introduction to Salesforce, it became very clear that there was a lot of opportunity to be had in this space. And really with the choice of Salesforce in the scheduling component, it also opened the door into our physician recruiting aspect as well, which is where Banner Health was introduced to MasTech in that space to deliver a true red carpet experience. So our PPME, or our physician pre-employment made easy, whatever acronym you want to call it, it was driven through providing that red carpet experience for our providers and really beginning their journey with Banner Health in just an excellent experience.
Well, thank you. And so we know that PPME, that particular portal was actually built out, I want to say a good handful of years ago. And then there was a decision to shift over into insurance and really pay a lot of attention to building out experiences around the insurance division. Danielle, can you tell us a little bit about why attention shifted there and why the focus, once it shifted to insurance, continued to be leveraging user experience as a driver for innovation?
Yeah, sure. So at Banner, we've had a Medicaid and the D-SNP plan for a few years now. And when the decision was made to bring Medicare in-house and launch a Medicare Advantage plan, we learned pretty quick that there's some challenges between what was set up for Medicaid and systematically what was set up for Medicaid versus Medicare, what the needs are for the Medicare systems. So being able to leverage the Salesforce platform to build some of these Medicare pieces was extremely important for us. We needed the ability to see what was happening with the members across the board, right? How do we bring them in? How do we integrate with some of our other systems? Because we don't want to just dump everything we have, right? I mean, how do they integrate with some of these other systems? And the fact that we needed some real-time reporting to be able to communicate within the organization what's happening with the membership was a big priority for us as well. Like I said before, the care and coverage journey is extremely important to us, start to finish, right? It affects star ratings, it affects, that member's experience, it affects just our scores in general. So bringing in Salesforce and understanding what that end-to-end member journey looks like was the right decision for us.
Awesome, thank you. And another thing that I thought was very interesting, between the first portal, which would be that Medicare Benny portal that you referenced, and the PPME, is that we actually leveraged slightly different applications to get both of those done. Belinda, can you tell us a little bit about the differentiators? What made them different and why that different approach?
Yeah, absolutely. Within the insurance division and the insurance technology specifically, the choice to run with velocity, right? Because there's a lot of standardization when you're talking about Medicare and Medicaid, right? Governmental regulations and those kinds of things that drive your workflows, right? And so the Salesforce product velocity really has allowed us to have a speed to market that, again, red carpet experience for our members, right? Because we want to provide them the opportunity to have a shopping experience where they're used to having a shopping experience, and really bring up the opportunities to scale quickly, whether it was adding new plans, or growing our brokers. So obviously it's important for us to sell our plans and for to make it available for our brokers to sell our plans. And so that red carpet doesn't stop with our physician incoming. It doesn't stop with our members. We want to make sure that everybody who interacts with Banner Health on any front has a really good customer experience.
That's really, and actually, it makes me realize when it comes to, when you're talking about velocity, you're talking about Health Cloud. After the acquisition, it was embedded into the Salesforce Industries, industry first cloud solutions. Amit, can you tell us a little bit about what those tools that we gained brought into Health Cloud and how that can actually be developed out for these different kinds of users and communities?
Yeah, so thanks first to Belinda and Danielle for giving the background about how they're using the tools. So we are super excited about that part. From our perspective, Velocity brought us a couple of things as part of acquisition. One, obviously, the functional footprint of Shop and Enroll, which is about the policy, if you look at Code to Card, as we sometimes call it, that functional footprint. But they also brought with them is the idea about consumer-grade tools, which Belinda was mentioning about things like which are called Omni Studio, Flex Card, some of these tools which allow you to bring consumer grade experiences with branded and workflows. So that's one of the most important things that they brought to us when we acquired. Also going forward, as we have tried to harmonize, and I think Daniela mentioned in her journey about it's multiple things that happen for the member. It is more about not only just Code to Card, but also the whole experience. Plus, after that is also an experience important. So it's not just about selling the insurance plan, but post-insurance plan, you're also thinking, how do you service? How do you help the member? How do you get them the right care? So bringing Velocity and Health Cloud together allows us to power those two things together, from buying and selling the plan, then servicing the plan. If you marry these together and then you apply the automated tools that they brought, then it becomes a really great picture for our customers to use out-of-box capability for both products, plus the toolkit that allows them to configure that secret sauce that they can drive their business processes.
That's excellent. And speaking of, let's actually dive into that one. We've been talking about the Medicare Shop and Enroll portal that we recently launched late last year. Venkat, can you step in? Tell us about it. Tell us about the project and what we did.
Sure. Thanks, Jesse. Thanks, Amit, for that background as well. And from Belinda and Daniel, and giving the background as well. So from our perspective, we started the journey sometime in August of 2021, right? We started as soon as we know that Banner is going with Velocity, we started the Velocity certification drive within Mastech, and then we got more than 100 plus developers certified in Omni Studio and Velocity certification, right? And we also did a hackathon to explore all the features, out-of-the-box features that is available in the Velocity platform in itself. So we had almost 9 teams from Mastech participate in the hackathon. And then there are very good healthcare use cases we developed out of it, right? That is the preparation we did before even we started the project. The project actually started sometime in October when we were doing the discovery. High-level discovery started in October 2021. And actual sprinting started in January of 2022. So the phase 1 we delivered in April 2022, basically to initial technical setup items. And then final go live, we wanted to be well in time before the open enrollment. So we went live in August 2022, right? So that gave enough time for Daniel and team to get used to the system and then make sure that they are not in a position where the open enrollment rush, the system is available much earlier, right? So coming to the implementation in itself, right? Majority of the time, we try to do the out-of-the-box implementation from Velocity, what is available. But I think majority of the items like drug pricing or even the PCP lookup, we have to integrate with external sources, right? And that is, again, the external sources identifying where you get the provider data and building those APIs to real time to look at all the PCPs that are available in the particular network, so that the member can, before even, during the shopping itself, he can decide whether his PCP's provider is available in the network or not. And the drug pricing, again, we had to go with various APIs, various sources where to get the drug information as well as the pricing, and then compare both drug pricing as well as the premiums along with the premiums in the same screen, where you can see the difference of what is the price that the member is paying from out of his pocket during the shopping in itself, right? So that's the kind of user experience that member is getting before even he decide on whether to go for plan A or plan B, those kind of things. And also in the drug pricing, sometimes we see the particular branded drug is not covered. We also recommend a generic alternative of the branded drug. So all those APIs, those are all the custom we have to build with the source system, right? Getting the data on demand basis and then trying to come up with the drugs that are available, pharmacy, as well as getting it from the external system, right? Basically the real-time integration. Those are all the pieces that we built in. So that's and the last thing I would like to also talk about is the easy, once the shopping is done, once the member is able to pick the plan or pick the plan, then easily it will move into the enrollment. It's like a seamless experience from shopping to enrollment. So that is where we had to integrate with the CMS, right? So we have to generate a file where the file will be sent to the CMS, and then we get the status back on where the enrollment is in the, so member can see on where the enrollment status is and things like that.
That makes sense. Danielle, can I call on you just to quickly shine a really brighter light on what changed? What was the process like before for people to try to sign up for a plan, and how did this portal really modernize that experience?
Yeah, I could definitely shed some light on that. So, one of the things we saw out of the gate, right, is our membership on our Benny portal. The Benny portal piece was low during lock-in timeframes. We prepared the team going into it, right? We launched in August, September timeframe, and we repaired, guys, we might get onesie twosies coming in through that portal. And I think the first week we got 5. So, just seeing those results out of the gate, knowing that, the member experience clearly had changed because they could walk through, end to end and not have to jump out to go see their drugs or jump out to go check their doctors or move around that way. Everything was in one nicely put together portal, and it was easy to use. Another thing that we saw was the ability to understand what the members were doing within the portal. We had a circumstance where a member went in and she intended to enroll. She got all the way to the last screen, but she didn't actually hit the submit button. And we saw it. We were able to see that enrollment stuck there. The team picked it up. We were able to make a phone call to that member and get her enrolled. What we also were able to do is say, okay, that maybe is not clear enough in the portal, and we were able to make real-time adjustments to say, okay, you're not enrolled until you actually see your confirmation number. There's some things that we put in that front end, and we were able to do that real time. It was done, I think, Belinda, within the day. I honestly think it was done. So just that line of sight into what's happening, where people are getting stuck. Is there some issues with the drug lookup? There's not, but I mean, you have that visibility into being able to see what's going on with that. And then the last part that we really did notice on this is kind of the check and balances of the files going back and forth. So, Venkat had mentioned that, we're getting some of these API files coming in and it is real time, right? And we're pushing out OEC files to our enrollment platform to process these enrollments. If something gets stuck or we can't see it, we know there's alerts going up. The sales or our IT team on this side is, raising their hand. My enrollment team sees like, hey, that file didn't come in. So just the visibility into what's going on end to end is 100% better than what we had before.
Right. So there were really changes on both sides of the monitor. There was a much, much better experience for folks actually looking to sign up.
That's
but
right.
then also on the back end, there was just a lot more information and the ability to course correct really fast. And the other thing I know, any organization listening to this right now is thinking, yeah, but what if something went wrong? Because when it comes to open enrollment, you want absolutely zero disruptions to operations. So what I'm curious about, Belinda, maybe you can answer this one, is what kind of safety measures or redundancies did you build in to ensure that though this was launched in time for open enrollment, you would not have any interruptions?
Yeah, absolutely. I mean, I think the foundation of everything that we do, there are those safety and compliance measures. So whether it's system redundancies or manual opportunities to verify through analytics, exactly what is occurring within the system, is at the very heart of what we do, whether it's on the healthcare delivery side or the insurance division. And I know that, anything that we move forward continues to take that into account through our rigorous security design assessments and our work with cybersecurity to ensure that, we are being good harbingers of any data that happen upon our doorstep.
That's excellent. Thank you. And I think in many ways, Banner Health can be seen as a microcosm for the industry. Some of your journey, what you're going through, a lot of other organizations are looking at like, okay, we need to do the same thing. But what I'm curious about is how much of that is affecting the industry. We know that Banner Health, with your mission for care and coverage, was looking to modernize anyway, but we do also have different factors influencing those decisions, whether it's the demands for people or government demands on different kinds of care options and what have you. Amit, can you give us some insight into the industry at large and how Banner Health's strategy is really very symbolic of what healthcare is going through as an industry?
I think definitely. I think the good part about this industry is that, as I always say, we experience this day in, day out. So as a customer, we have seen that our experiences, what we look at Amazon's and the Netflixes of the world, is the same experiences we want in our health system. So with Banner's plan of, say, example that I think Belinda mentioned about somebody left in the cart, they did not finish that buying that policy or that plan, is very similar to an experience that you would have on a retail website. Think of it, if you were to go and shop on a retail website and you have something in the cart, but you did not finish that transaction, they will send you an automated email reminder. I think that understanding what Banner has done is the great example of taking learning from other industries and applying to health. So as we look at it from our perspective, we look at the industry facing 3 or 4 key challenges. One is that what we have seen, and we talk about workforce burden and the amount of stress that we have. So automation is becoming very much key. Digitizing is becoming very important in the industry. So I don't know if you look at the numbers in US healthcare, the US healthcare system spends around $3.7 trillion in the whole US healthcare economy, out of which around 25%, which is $1 trillion, is administrative waste. So if we look at those numbers, we can definitely prioritize automation and digitization as the key principle to reduce. And things like what Banner has done about having a patient portal or a member portal where they can go in, they can look at their insurance, do a real-time quote, that all saves the time that a call center agent would have to help, they can do more work for Banner itself and more productive in that sense. So that's one key thing that we're looking at. We also look at things like access to care has becoming important in the terms of in my preferred channel, whether I'm getting the care through virtual, through visiting a hospital, through a retail clinic. So that is all becoming very important as how do you offer care in the channel. So it's a similar concept as what you would see as retail has gone through. Let me give you what you want to buy in the channel you prefer. You want brick and mortar, you want online, you want through Amazon, the same experience we're expecting in health. Finally, that ties all of these together is the idea that we have health silos, which we should avoid. So I think just what Banner has done is one shop and enroll, and which is exactly to our strategy of bringing Velocity and Health Cloud together. We should not have two systems. Okay, here you have bought an insurance, and if you walk into a Banner care facility, they should know you immediately, day in, basically. Think of it as if you log into Amazon or Netflix from your home, or you log in from some other place out in a hotel that you are in, they know you. It's the same person, same human. So that consumer experience should also drive. And those are the things that we are seeing that industry in healthcare, whether is driving towards across all our customer base. And that has become a key thinking pattern or paradigm.
That's actually brilliant. Thank you for sharing that that vision and how Salesforce and some of these, different tools that you can flex are really helping to pave the way to create these better experiences, automations, just better care. It leads me to ask, what have we learned? I know that Danielle touched on this a little bit already, just in talking about some of the course corrections and positive benefits that are already showing from launching the Medicare self-enrollment portal. But is there anything else that you really feel like, wow, that was a success or a lesson learned, we're going to take that into the next project?
Yeah, I definitely, JC, there were, I think one of the things we learned out of the gate was we need some dedicated staff and some resources to the project. When we're launching and we're moving this, it's extremely time consuming and it can't be tied to one person, right? You need to be able to be in the meetings, be able to make decisions and keep things moving. One of the fabulous things that we did on our side was we put 4 people through the Trailblazer program that Belinda and her team recommended. And that was wonderful. It helped them understand, help them think outside the box, understand what they're building and how they're building it and why they're building it. So that was very helpful. And then we attended some of the conferences too that Salesforce held, which was helpful for the team to really, well, they're called Dreamforce, right? To really think outside the box and dream, and what can they build and how do we get there? And what are the different, partners, just in general, how do we combine what we want to build and make it a success? And then one of the last things that I will say was a challenge on our side was getting people to think outside of their regular jobs, right? What we're doing today that they've been doing for the last 5 to 10 years, why are we changing? And how do we show them this is what we're doing? How do we get there? This is, and I think this team has done a fabulous job to just, outline, build it. It's an open slate, right? Build what you want to build. We're going to start with the minimum viable product, as Belinda likes to say, MVP, right? And then we're going to keep adding on from there. And I think once the team saw, we have added on, right? We did roll out the MVP product, and we have since, we continue. There's still phases going, I think bi-weekly, right, Belinda, that add on to our portfolio of this product. So, and it's also too seeing the bigger vision. What do we want to build? What's the 5-year vision look like, right, team? We say care and coverage together. To Amit's point, we really want the member to understand, entirely through, and doctors can see what we're doing on our side, and the labs can see what the doctors are ordering, and our care managers can be coordinated in when needed. We have other things like Silver and Fit for our fitness vendor, and we've got picks for the mental health. Like, how do we tag all of our different vendors in and make this one comprehensive end-to-end member experience?
That's awesome. Over to you, Belinda. What did you come away with from this process?
Well, the lessons are not completely finished learning right now. We have, we've just gone so far. I mean, we've gone a long way, but it's still just a little notch on the roadmap of what's truly possible in the insurance division. And again, I have that unique experience and visualization from healthcare delivery side, and where we started with scheduling and PPME and sales, and how those have grown over the last 5 years. And it's been, I think, almost an easier journey in the insurance division because we knew education was forefront. We needed to make sure our business partners were educated on the platform and what the capabilities were. I think that was number one. And number two, agile, right? Agile is definitely a new way of working for some people. And it's really interesting when working with our stakeholders. And I know, Venkat, you probably have a thought on this as well, is the maturation that like our development teams have gone through, along with our vendor partner MasTech, right, over the last 5 years, and how we've been able to take that forward to the insurance division to say, let's train agile right away. Let's talk pie in the sky right away and get you educated on what the objects are, the fields are, and just the very basics of Salesforce, so that your team has the tools that they need to go out and dream about what they want their job to look like in the next 5 years, because we've taken away a lot of those fundamental base challenges to allow them to really, start thinking about and excelling. There's still lessons being learned on the healthcare delivery side that we're able to bring over to the insurance division, right? As we talk about bringing in bots and chat bots and voice bots, and healthcare delivery gets to take that live and learn those lessons. We can work the bugs out and then bring like the really nice product over to the insurance division, so that they don't have to do that baseline understanding, and we're already working the kinks out. So lessons are never done being learned in the technology space. And obviously Salesforce continues to bring excellent products and packages to the table, so that we can work with our partners to say what makes sense for our roadmap, what makes sense for Banner, what makes sense in that red carpet experience. To Amit's point, shopping is shopping, and everybody has an expectation of what that shopping looks like. And so how can we continue to expand upon that?
Venkat, what about you? I know this was interesting because with the Shop and Enroll portal also was the start of you even stepping into the relationship with Banner Health. What was that experience like?
Yeah, it was a very, I would say, rewarding experience, I would say. It is basically learning about the Banner and how the Banner works and the culture and everything. And also we did a bit of investment before the project itself, like, getting people ready with the certifications and things like that. So that team is ready to take on the challenge, right? That really helped. From the lessons learned perspective, right? I think there are a few which I can point out, like initially when we were doing it, we did not go through the branding or of the UI, and some of them, like, not even properly not tested in the multi-browser as well. So those things came very late in the game. So team has to again get together and try to fix all those issues before the go live. But I think that's one of the learnings probably in the next project. We should be looking at all those things, understanding the process from Banner, right? What are the approvals we need to get from the branding team, or from architecture team, or from the QA team, and what kind of testing they need to do, all those things. So I think that will really help into our future projects, right? So I would say those are all the very good learnings for us. And then we are in the current project that we are right now, which is the broker, which is going live next month. So we are in a better position, right? At least from that perspective. So those are all the some things that I would like to share on.
That's excellent. Thank you for sharing that. And I think it is very interesting the way that Banner Health has gone about this. Of course, for something like the portal, it had to be launched all at once. It had minimally viable product, you called it. It had to be in that state. But now you're able to take that moment to stop, reassess, course correct, but also look, okay, what's the vision here? And I think that's where Salesforce also has a lot of power, because you can almost socket in additional clouds almost in a modular way to increase the functionality of the system that you're building, and it can be done in a very seamless way. Marketing Cloud, for example, can be brought in to help really build out that journey from the modern shopping experience into a modern kind of engagement, and really advocacy for patients and members, and helping them empower and taking charge of their own care. So there's really a lot of power there, and a good, strong platform to do it. Amit, I've got a question for you based on that one. Speaking from Salesforce's perspective, as an organization that does concentrate on the bigger picture of the healthcare industry, all the way down to the smallest detail, as enhancements and solutions are developed, what advice would you give to an organization about to embark on a similar journey?
Yeah, I always say that healthcare has been the most interesting industry that I've worked in, because it impacts all of us. We experience day in, day out. So it's not a different industry like consumer goods or manufacturing, where you're building software for something that you'd not touch or feel or experience. So I think the most important thing I always say, keep in mind, will you use it? Whatever we are building, will you use it? So that question you should always ask. Do you like it? Would you use it? If yes, then most other people that you're launching for, whether it's members or patients, will also like it. The second thing I always say is that take a step back before you start. What is that you want to achieve? The North Star might be further away, 3 years, 5 years. I think, Danielle, you mentioned about a 5-year journey. But we should at least know what the North Star is. And then take a very small piece to show a success. Because success breeds success. Once people know that you have seen success, you have moved things, that you have made things better and simpler for our members or patients, then it automatically starts into the DNA of the company. So sometimes it needs some change, but I think that's what the two things. If you like it, others will like it. Keep that in mind. Make a big overall where you want to be, and take a very small chunk of it, which is easy to execute in the first chapter, gets the value, people see the value of it, because then there'll be a lot of adoption of the change that you're trying to do.
Mm-hmm. Absolutely. Thank you. That's perfect. And I think we're actually gotten through most of this. We're at the point where we can start to tackle some of the questions that people have. And one of them really bounces off of what Amit just said. And that's kind of what kind of recommendations would you have for other organizations that's looking for a similar journey? And I'm wondering what the rest of you have to say about that, if at all. Danielle?
Yeah, I think it's 100% spot on. I know Belinda touched on the agile function that we're doing in-house for this project, and really taking a look at, that's exactly how we've set this up, right? I mean, we started with the shop and enroll. Our next phase is going to be the broker portal piece. So we're going to launch our certification and training piece in there. Next will be broker commissions. Eventually, it just keeps layering and layering. And it is, you get the small wins, right? It's a big deal to close a project and see the progress of it. So from our standpoint, I would 100% agree with Amit's recommendation on phasing it out. And I think that's the only way, unless you have a giant organization where you have all the staff in the world to break these pieces into different groups. I don't even know to try to do it all at once, if that's even if that's even realistic. I think we really have to break it into these pieces.
Definitely. Cool. And one of the other questions is what's next, which you just touched on, moving over into broker portal. And so much as you're able to share, why move to that? What's the importance of really nailing down that broker experience?
So I think, again, like from the beginning, where we've focused a lot on the member journey, the broker is a big piece of that, right? In today's world, the certification and the marketing piece, we have that built, but we don't have a lot of how that broker can help that member, right? in today's world, they can't do a PCP change. The member has to call into the call center. There's just some basic things, ordering ID cards for the members, right? And the members should have that relationship with that broker, and they are going directly to that broker to try to get help, right? So instead of having that broker say, oh, sorry, actually, we can't help you, you need to call member services. We're going to give them the functionality within this portal to be able to help service that member as well. And just clean up too the yearly certifications and the marketing material. How easy can we make their job, right? How can they see an application status? They submit an application for a member, and in today's world, they don't really have line of sight, so they're calling our broker support team, who says, "Yep, we received it. It's pending CMS." Approval, right? And in this journey, we're going to be sending the file from our enrollment system back into the Salesforce system, just so almost real time, so they can say, yep, okay, we definitely received the application, and we're missing some information, so we need you to call us or complete the application. We need some additional information. So just giving them line of sight into what's going on, and to help them understand what's going on our side too. Both sides there.
That makes sense. It makes absolute sense. And speaking to that overarching strategy that Banner Health has really put into place to get different divisions and services across, kind of onto a single cloud platform, what, in your opinion, are the benefits for even doing that?
Linda, you want to answer that?
Yeah, so I think that's maybe a little bit of a misconception about this kind of singular cloud, right? It's actually twofold. I want to answer it in two parts. One is the strategy, and I think, and Danielle will probably agree with me in that we have excellent senior leadership who have a vision for the value stream and how we're able to take our technology and really pinpoint what is valuable to the organization. So I just wanted to piggyback on that strategy conversation. And the second piece is in the health cloud space. So we have multiple clouds: marketing cloud, health cloud, sales cloud. And when we're talking about healthcare delivery versus insurance division, right now there is truly, I spoke to being a good harbinger of data, right? Right now there's kind of an iron curtain between the two functions, because we want to be very clear in, as part of the strategy with our compliance and operations team about how that data plays into itself ultimately. And so I think we're readying the waters for when there can be some kind of mixing, but ultimately, a lot of that will come down to, a lot of the recommendations that are provided. And like I said, we just want to make sure that we're ready for that, so that we can ultimately, talking again about the red carpet, but then let's talk about the 360 journey, care and coverage together, and what that visual representation looks like for a singular Banner Health customer.
That's awesome. Thank you, Belinda. And shockingly, we have gotten to the end of our questions. So it looks like people will get a few minutes back on the hour. Thanks, everybody. Thank you, panelists, for joining us and sharing your story today. Thank you so much. And thank you to the people who joined us on this webinar. If you have questions that were not answered, please feel free to reach out to us on social media or via email, and we will all do our best to get you some answers. So again, I will thank you all for joining us and wish you a great day.